What symptoms mean you should call the doctor for kids? When it comes to your child's health, knowing when to call the doctor can be tricky. It's important to pay attention to certain symptoms that may indicate a serious issue. Let's go through some key signs that mean you should reach out to a healthcare professional. First, if your child has a high or prolonged fever, this is a reason to call the doctor. A fever lasting more than 4 to 5 days is concerning. For babies younger than 2 months, a fever over 100.4 degrees Fahrenheit is serious. If your child has a fever of 105 degrees Fahrenheit or higher, or a fever over 102 degrees Fahrenheit lasting more than 2 days without a clear cause, it's time to seek medical advice. Next, watch for any breathing difficulties. If your child is breathing rapidly, wheezing, coughing persistently, or if their lips turn blue, purple, or gray, you should seek immediate medical attention. Lethargy or an altered mental state is another red flag. If your child seems unusually sleepy, difficult to wake, or unresponsive, this is a situation where you should call the doctor right away. Seizures are also a critical concern. If your child experiences a first-time seizure or a seizure lasting more than 5 minutes, call emergency services. For shorter seizures under 2 minutes, contacting your doctor is still important. Severe pain or persistent vomiting should not be ignored. Intense abdominal pain, a headache with a stiff neck, or repeated vomiting are all signs that requiring medical evaluation. Signs of dehydration are serious too. If your child has a dry mouth, no tears when crying, very dark urine, or hasn't had a wet diaper for over 8 hours, you need to seek medical advice. Injuries can also be concerning. If your child has a head injury with loss of consciousness, nausea, or unusual behavior, or if you suspect a broken bone, you should get medical help. Deep cuts that won't stop bleeding after 5 minutes of pressure or severe burns, especially on sensitive areas like hands or face, also requiring urgent care. Watch out for severe allergic reactions. Symptoms like swelling, difficulty breathing, nausea, or changes in responsiveness are emergencies that need immediate attention. An unexplained rash can be troubling too. If your child develops a widespread red or purple rash, especially with fever or other symptoms, it's important to call the doctor. Finally, other concerning symptoms like a stiff neck, severe headache, severe sore throat, or severe earache should not be overlooked. If any symptom causes significant distress or concern, it's best to consult a healthcare professional. If you are ever unsure whether a symptom requires a doctor's visit or emergency care, it is safest to call your pediatrician or seek emergency services. Trust your instincts. If you feel your child needs immediate medical attention, do not hesitate to call emergency services or go to the emergency room. Remember, it is always better to be cautious when it comes to your child's health.